During the Fontan surgery, the inferior vena cava is detached from the atrium and attached to the pulmonary artery. Now, all the blue blood from the upper and lower body is returning directly to the lungs to be oxygenated, and the patient is no longer cyanotic. But what if the patient has severe respiratory or cardiac failure and ends up on ECMO? Like all other forms of heart disease, there are three options for cannulation: neck, central, and femoral. After stage 1 palliation, all three options cause blood to be drained from the right atrium and injected into the aorta, so the circuit management is the same regardless of cannula location. In the Glen, central and femoral cannulation is similar, but neck cannulation results in drainage only of the upper body, making this cannula location potentially challenging. Fontans have many of the same issues as the Glen, since blood flow through the lungs is passive, but this time, neck and femoral cannulation have similar management, since both cannula locations are attempting to drain the Fontan circuit. Whether the cannula is placed in the SVC or the IVC, the goal is to get the tip of the cannula near the confluence of these veins and the pulmonary arteries so the blood can be drained from both the upper and lower body venous circulation. However, getting full decompression of the Fontan circuit and full flows with just one cannula is difficult, and you may not be able to fully support the patient with one cannula. About half of Fontan patients peripherally cannulated will require a second cannulation site. Central cannulation is different than after the Norwood and the Glen. In most cases, the venous cannula will be draining the atrium with the arterial cannula injecting into the aorta, just like the others. Unlike ECMO and other anatomies, the lungs aren't being bypassed at all. In fact, if you remove the oxygenator from the circuit, you have a nice ventricular assist device that can work well to support your patient if myocardial failure is their only problem. But if the lungs are sick, this cannulation strategy may be challenging. Sure, if the lungs aren't oxygenating the blood and it is returning to the heart blue, you can use a standard circuit with an oxygenator. But like the Glen, blood doesn't flow well through the Fontan when the lungs are sick and pulmonary artery pressures are high. So what can we do? Like in a centrally cannulated Glen, keep the pulmonary pressures as low as possible and flow as high as possible to lower the atrial pressure, and a second cannula to drain blood from the Fontan may still be required.